Respiratory obstruction. 1 definition. Obstruction blockage of the airway occurs when the breathing passages become narrowed or blocked, making it hard to breathe. Areas in the upper airway that can be affected are the windpipe, trachea, voice box, larynx, or throat, pharynx. 2. Etiology. The airway can become narrowed or blocked due to many causes, including allergic reactions in which the trachea or throat swell closed, including allergic reactions to a bee sting, peanuts, antibiotics, such as penicillin, and blood pressure medicines, such as ACE inhibitors. Chemical burns and reactions. Epiglottitis, infection of the structure separating the trachea from the esophagus. Fire or burns from breathing in smoke. Foreign bodies, such as peanuts and other breath-in foods, pieces of a balloon, buttons, coins, and small toes. Infections of the upper airway area. Injury to the upper airway area. Peritonsillar abscess, collection of infected material near the tonsils. Poisoning from certain substances, such as strychnine. Retropharyngeal abscess, collection of infected material in the back of the airway. Severe asthma attack. Throat cancer. Tracheomalacia, weakness of the cartilage that supports the trachea. Vocal cord problems. Passing out or being unconscious. People at higher risk for airway obstruction include those who have neurologic problems such as swallowing difficulty after a stroke, lost teeth, certain mental health problems. Young children and older adults are also at higher risk for airway obstruction. 3 signs and symptoms. Symptoms vary, depending on the cause. But some symptoms are common to all types of airway blockage. These include agitation or fidgeting, bluish color to the skin, cyanosis, changes in consciousness, choking, confusion, difficulty breathing, gasping for air, leading to panic, unconsciousness, wheezing, crowing, whistling, or other unusual breathing noises indicating breathing difficulty. 4 exams and tests. The healthcare provider will do a physical examination and check the airway. The provider will also ask about the possible cause of the blockage. Tests are usually not necessary, but may include bronchoscopy, tube through the mouth into the trachea and bronchial tubes. Laryngoscopy, tube through the mouth into the back of the throat and voice box. X-rays. 5 Management. Treatment depends on the cause of the blockage. First, encouraging the victims to cough, and allowing them an opportunity to spontaneously clear the foreign body if they are coughing forcefully. If the person's airway continues to be blocked, more forceful maneuvers such as hard back slaps and abdominal thrusts, Heimlich maneuver, can be performed. Objects stuck in the airway may be removed with special instruments. A tube may be inserted into the airway, endotracheal tube, to help with breathing. Sometimes an opening is made through the neck into the airway, tracheostomy or cricothyrotomy. Nursing management. Nursing diagnosis, ineffective airway clearance. Actual risk for potential decreased energy and fatigue. Ineffective cough. Tracheobronchial infection. Tracheobronchial obstruction, including foreign body aspiration. Copious tracheobronchial secretions. Perceptual cognitive impairment. Impaired respiratory muscle function. Trauma. As evidenced by abnormal breath sounds, crackles, rhonchi, wheezes. Changes in respiratory rate or depth. Cough. Hypoxemia cyanosis. Dyspnea. Chest wheezing. Objective expected outcome, the patient will maintain airway free of secretions. Nursing interventions. Scientific rationale. Assess airway for patency. Maintaining the airway is always the first priority, especially in cases of trauma, acute neurological decompensation, or cardiac arrest. Assess respirations, note quality, rate, pattern, depth, flaring of nostrils, dyspnea on exertion, evidence of splinting, use of accessory muscles, position for breathing. Abnormality indicates respiratory compromise. Assess cough for effectiveness and productivity. Consider possible causes for ineffective cough, respiratory muscle fatigue, severe bronchospasm, thick tenacious secretions, and others. Note presence of sputum, assess quality, color, amount, odor, and consistency. May be a result of infection, bronchitis, chronic smoking, and others. A sign of infection is discolored sputum, no longer clear or white, and odor may be present. Monitor arterial blood gases, ABGs. Increasing PaCO2 and decreasing PaO2 are signs of respiratory failure. Assess for pain. Postoperative pain can result in shallow breathing and an ineffective cough. Assist patient in performing coughing and breathing maneuvers. To improve productivity of the cough, encourage oral intake of fluids within the limits of cardiac reserve. To prevent drying of secretions, demonstrate and teach coughing, deep breathing, and splinting techniques, so patient will understand the rationale and appropriate techniques to keep the airway clear of secretions. 6. Prognosis. Prompt treatment is often successful, but the condition is dangerous and may be fatal, even when treated. 7. Possible complications. If the obstruction is not relieved, it can cause brain damage, breathing failure, death. 8. Prevention. Prevention depends on the cause of the upper airway obstruction. The following methods may help prevent an obstruction. Eat slowly and chew food completely. Do not drink too much alcohol before or while eating. Keep small objects away from young children. Make sure dentures fit properly.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.